Good evening, nerdfightastic. It's Saturday and I'm returning us to regularly scheduled programming despite the fact I'm still sick. That's dedication, people. This is the point where there would be an intro if in fact we had an intro, however we do not, so instead enjoy me pulling funny faces and this copy of Sense and Sensibility by Jane Austen. So as many of you are, I'm sure, aware, I have been sick as of late, since pretty much the beginning of July, and this is kind of sucky. Now, healthcare has been sort of a buzzword recently, both on this side of the pond and the other side of the pond, so I thought I would discuss it today and explain A, what's going on with me, and B, how that kind of works. If you get what I mean. If you don't, please save your questions to the end, because I'm about to explain it all. Basically, in England we have something called the NHS, which is the National Health Service. The National Health Service is about 60 years old, and it's essentially socialised medicine, as you Americans like calling it. Anyway, the NHS exists in this country as free healthcare for all, alongside private HMOs, such as Bupa, for example. They're a private healthcare organisation, and you can choose to pay private healthcare if you want, and you'll probably get treated quicker and maybe slightly more effectively, but the NHS does a fine job. Here's an example involving moi. I've been to the dentist twice this year, once for a checkup and once for a procedure. That cost in total about £45. The dentist you have to pay for is £16 for a checkup, and the procedure I had cost £30, which is probably an awful lot less than you would pay in America through your health insurance gig. I've also been to the doctor in recent weeks 5 times. I've had 4 different prescriptions, and on Monday I have to go to the hospital to have a scan. And all of this has cost me nothing, except the prescriptions, which cost me £7.50 a pop. And that's standard. Every prescription costs £7.50, doesn't matter if it lasts a year, a week, 2 days. One prescription costs £7.50, standard cost. And I think that's pretty awesome. My gran broke a hip a number of years ago. They whipped it out, put a new one in a day. My dad's next door neighbour went to the doctor because he was having a problem with his sight, and it checked out. He had a cancerous tumour in his eye. 2 days later he was off to see a specialist in Liverpool. They whipped it right out, job done, and he's got to go back for checkups every 3 months, but generally speaking he's fine. And these are all good examples of the NHS working, and there are plenty of examples of the NHS not working, don't get me wrong, but private HMOs make mistakes as well. I've seen enough scrubs to know that. But I just don't understand where this inherent fear or hate of socialised medicine comes from, because it really can only do good to have everybody covered by health insurance or some kind of healthcare. I don't understand why you wouldn't want that. And I'm happy with that my money is going to help people who need help, and in some cases, as now, other people's money is going to help me because I'm not well. It seems like a pretty good system. It's not perfect, but it's pretty damn good. It's medicinal. Anyway, I've been babbling for a long time now, so I'm just going to finish up here with my secret. I still can't think of anything decent. This is really hard. That's what she said. YouTube confessions. I like Meeky Kitty. Is that a confession? People tend not to like Meeky Kitty. I really like Meeky Kitty. I'm just saying. Pretty much everyone just clicked off their browser right then, didn't they? Yeah. Also, I don't like the Anglerfish song. That's kind of a confession. I really don't like it. It's not one of Hank's best. I just don't like it. All your dreams are now dead. So I will leave you with that. Everyone have a mighty good week. I'll let you know in the chat, people, how things go. Everything should be cool. And everybody else, I will see you next week. Liz, I will see you tomorrow. Taddy bye.